Doctor, you mentioned asymptomatic, non-paralytic poliomyelitis. That is correct. Is that the abortive type? Yes, devoid of symptomatology referable to the central nervous system. Doctor, what about paralytic poliomyelitis? Well, that is a bulbar poliomyelitis. And by bulbar, you mean an involvement of the cranial nerve nuclei? Yes, and particularly the respiratory center in the medulla. And is it the most serious type of poliomyelitis, doctor? Well, it does cause respiratory paralysis. Doctor, spinal paralytic poliomyelitis usually is an involvement of the anterior horn cells of the spinal cord. Is that not correct? It is resulting in characteristic stiffness, yes, of the spine and spine tightness of the hamstring muscles, followed by paralysis of the lower extremities. Does it present the classical form of poliomyelitis, doctor? Yes, it does. And is that spina bifida? Yes, spina bifida is a congenital defect consisting in the absence of a vertebral arch of the spinal column. What may it cause, doctor? It may cause a meningocele, which is a protrusion of the meninges through the defect in the spinal column. Doctor, the meningomyelocele is a herniation, is it not? Yes. Of what? Of the cord and meninges through the defect of the vertebral column. Doctor, the syringomyelocele is a protrusion of the cord and meninges through a defect in the spine, is it not? It is a cord tissue, which is a thin-walled sac filled with fluid from the central canal. Doctor, the spinal cord injury is a trauma, is it not? Yes, it is. To what? It is a trauma to the cord produced by fracture or dislocation of the spine, which may cause irreversible damage and disability. Doctor, what about the compression of the cervical cord? Well, that is a complete transverse compression of apparently the cervical cord, which may cause lifelong quadriplegia or paralysis of the arms and legs. And also, doctor, loss of sphincter control? Yes, loss of sphincter control, or be fatal due to phrenic nerve injury and subsequent respiratory paralysis. Doctor, what about the compression of the thoracic and lumbar cord? That is a pressure on this area which may cause paraplegia or paralysis below the waist and sphincter disturbances as well. Doctor, the compression of the spinal cord may also be due to cord tumor, yes, and herniated intervertebral disc affecting the spinal cord root of the lesion. Doctor, is it a subacute sclerosing panencephalitis? Well, that is called Dawson's encephalitis, which is apparently an uncommon form of inflammation of the brain occurring between 4 to 20 years of age. How many stages are there that are recognized? Well, in my opinion, 3 stages are recognized. A, behavioral disorders at the outset. 2, mental deterioration, myoclonic jerkings, and convulsive seizures as the disease progresses. Doctor, is there stupor? Yes, stupor, dementia, rigidity, blindness, and coma in the terminal phase. Doctor, what about the locomotor ataxia? Well, if there is syphilis of the central nervous system clinically recognized by a peculiar gait, then you might have locomotor ataxia. Doctor, what are the operative terms? Well, carotid artery ligation. And what is that? That is a tying of the carotid artery in its cervical portion, or using a Silverstone or Crutchfield clamp to gradually occlude the blood flow in the extracranial portions of the common or internal carotid artery. And doctor, the carotid end aortorectomy which you performed, I note that in the hospital record. Yes. What is that? That is a removal of plaques or the intimal lining of a carotid artery in the occlusive cerebrovascular disease. This removal may be carried out at the carotid bifurcation and followed by a reconstruction of an internal carotid artery with a Teflon graft.
Was it?
Was that in English?
Huh?
Was that in English?
Was that what?
In English?
Oh. You should know most of that stuff. Were there any ones you didn't recognize?
No, actually, I did recognize a lot of them.
But like every medical, that you got to write syllabically. But first you have to recognize the word. Okay. How do you write poliomyelitis?
Poliomyelitis.
Let's skip that.